Welcome to the third segment of our presentation on menopause. Let me start by saying to you all, Happy Mother's Day. A mother is a very dear person. Today we are celebrating Mother's Day. We celebrate your existence and the love that you have given unto us. And as you looked after us, we need to look back and give back to our mothers. By looking back or giving back to your mother, you are increasing the chances that the good Lord can bless you. You are increasing your blessing that God must give you. As God said, the Bible says, so looking after an older person increases your chances of blessing. Menopause is not a stage where you should look at yourself and regret why you are old. It's the stage that you must be proud that you are a senior citizen and appreciate the changes that happens in your body. Some of the few changes that I'll mention are the lipid changes, changes in fat. There is increased the level of blood fat, which is called cholesterol in the blood. Other fats are triglycerides and low-density lipoprotein. This is because of poor metabolism, and it increases the chances of postmenopausal women to develop heart diseases, especially ischemic heart diseases. They develop a stroke which is called ischemic stroke, as opposed to hemorrhagic stroke that usually is found in patients who are hypertensive. This ischemic stroke happened because of blood clotting inside the vessels and blood not going to other vital parts of the brain as you develop such stroke. So it's important that every postmenopausal woman should go for annual cholesterol and lipid profile examination so that if there's any derangement, it can be corrected. Again, other changes that you will observe and dislike is changes in the body. We develop what we call apron belly. Because of pregnancy, your abdomen has been stretched, your abdominal wall has been stretched many times, and you develop the devarification of the rectus muscles. The rectus muscles divide. As they divide, you develop what you call stretch marks because of stretching of the skin. But during menopause, you lose the fat underneath. As you lose the fat underneath, the skin does not shrink, so it becomes a redundant skin. So you develop an apron, a belly that's sort of falling down, what you call a panniculus. This panniculus, it will become worse and worse as menopause proceeds or as you grow older. The treatment of panniculus, because it usually puts weight on the spine, so it might give a woman a low backache. Treatment of panniculus is surgical. Surgically, it can be removed and the shape being restored such that it doesn't change your physical look, and it also relieves that backache that I talked about. In panniculectomy, one can remove a skin. In this woman, we removed a skin of 2.8 kilogram. A 2.8 kilogram reduction in weight means a lot to the spine of a postmenopausal woman. Another system that is affected by menopause is the digestive system. During digestive system, menopause, you've got increased transit time. Increased transit time means from the time you swallow food in the mouth to the time it come out there is increased. It might take 2 days. That's why you eat food today, only after 2-3 days, then you start to have the effect of that food. Because of poor malabsorption, which is called malabsorption, you develop constipation. And with constipation, when you go to the loo to do number 2, you sort of strain and push hard. And as you push hard, you develop hemorrhoids. Postmenopausal women hemorrhoids are because of constipation and malabsorption. And this straining at stools will also lead to pelvic organ prolapse. Organs like the uterus and the cervix, the rectum and the bladder will sort of prolapse and come out there. And with that, it changes this valve that keeps the urine tight. So as the valve is damaged by this continuous pushing down. You develop incontinence of urine. The type of incontinence called stress urinary incontinence, which happen when you cough, when you sneeze, when you pick up heavy object, when you laugh, urine leaks. That is because of the changes in menopause. And here I want to demonstrate to you when I said increased transit time because of poor peristalsis. Our intestines are always in a continuous motion inside us, pushing food from the stomach down to the rectum, out at the anus. If the peristalsis is sluggish, it takes time for food to go through from the stomach to the anus. This is a picture of peristalsis that I've shown you. The other changes that happen in menopause are breast changes, which women notice very easily, and most of them do not like them, but they have to accept them. In thin women, the breast becomes flat and becomes shriveled and smaller. If we are putting size C bra, you have to change to a lower bra, maybe to a B bra. In heavy built people, it becomes flabby and pendulous because of loss of supporting fat and the stretch on the ligaments that attach breast to the chest. Looking here is a normal breast anatomy. The breast tend to sag down, which is called process of the breast. If you look here, the bottom of this breast is more or less above the top of that breast. The breast comes down. Sometimes it goes up to the level of the umbilicus. As it comes down here, it elongates and it flattens. The treatment thereof is putting up nice bra, and with hormone replacement therapy, the negative effect of breast sagging might be minimized, not prevented. You can't prevent it, but you can minimize the effect of breast sagging. The treatment, another treatment in those who are very aesthetic and plastic, they can undergo mammoplasty. Mammoplasty is breast reduction and breast reconstruction so that the breast, even at menopause, can still remain in a better shape. Of importance is that people should do, all women, whether menopause or premenopause, should do self-breast examination, which you can palpate your breast every day, at least once a week. You can go in a clockwise pattern to feel for lumps and bumps in the breast. If there's any lump and bump, please consult, let it be investigated to find out if it's just a benign lump or it can be a malignant breast lump. Or you can examine your breast in a wedge pattern. In a wedge pattern, you can move from the nipple outwards, all around concentrically, so that you mustn't miss any area of a lump or mumps. Do not rely on a husband. The husband are very bad when they palpate the breast. They'll find a lump and think and play with it and think it's just something for romantic, while actually it's a dangerous breast cancer sitting there. Because breast cancer cells are deep inside the breast. They are not superficial. So when you do breast self-examination, palpate deeply so that you can even feel the deep things. By the time you realize that your breast is swollen or is changing color to either red or dark, it might be too late for breast cancer, which means it started to spread. It started to spread to other organs. The breast that looks like this is called peau d'orange, which means breast that looks like orange peel. That is a very late sign. It's a bad sign. You don't wait for that to consult. The other mode, if breast cancer is discovered early, it can be removed locally, which is called lumpectomy, without sacrificing the entire breast. But if it's discovered late, the entire breast will be sacrificed, which has got its own consequences. Because as I've said, the breast cancer can spread through the blood vessels. By the time you realize breast secretion, change in color, peau d'orange, is likely very late, and chances are that you're going to lose the whole breast. And maybe if you've got finances, you'll do breast self-examination. And the healing of breast cancer is not very easy. Sometimes it doesn't heal very well. It heals with fibrosis, with sepsis, which is a problem that will encounter post mammoplasty. It's important that every woman, whether menopausal or premenopausal, should every 2 years go for a test called mammogram. Mammogram is a radiographic test that detects breast cancer early. It is even more sensitive than breast self-examination or breast sonar. I advocate that all women, whether menopausal or before menopause, they should go for breast cancer examination by the process called mammogram. Ask your doctor to refer you for mammographic examination. The other last thing that every woman should do, even in the menopause, is cancer of the cervix. Cancer of the cervix is an infectious cancer. It is caused by a virus called human papillomavirus, which can be transmitted through any medium, from sexual contact, through water, fingers, fomites, and anything. The pap smear that is done, which is advocated to be done every year, it detects the cancer at an early stage, in a precancerous stage. By the time the cancer appears as a sore or a lesion on the cervix, it's already beyond the precancer stage. It's always a cancer, which a pap smear can also depict. Cancer spread from the cervix contiguously, which means it affects adjacent structures. It might start as a small lesion and later affect the entire lesion. It is important that one should do a pap smear so that if cancer of the cervix is found either in the precancerous stage or in a lower stage, which is stage 1A or B stage, can be removed surgically, which means operation can remove it completely. But once it goes to stage 2B or 3 or stage 4, it cannot be operated. It can only be radiated, which is not an optimum treatment for for cervical cancer. So it's important that one should go for annual pap smear. Every year you must go for a pap smear to check for either precancerous stage of cells or to catch cancer in its early stage, because cancer of the cervix is a curable cancer. You can cure it. Another last thing that I advocate that women in menopause should do is annual transvaginal sonar examination of their ovaries. Although ovaries now are not producing more estrogen and progesterone, they can also undergo other diseases and have other diseases like torsion or even malignant changes. So annual pelvic sonar examination is recommended. Here I want to show you a postmenopausal woman who presented with pelvic pain, and on examination we find that she had an ovarian tumor which had torted and was causing the pain. Upon removal of that tumor, it was discovered that it was an early cancer of the ovary. So it's important that you should go for every year, go for annual transvaginal sonar examination to check whether your ovaries are in good health or not. Because cancer of the ovary is very notorious. By the time it's discovered as cancer, it's already spread to other organs, which means it's incurable. I want to recommend pap smear screening that must be done every year. Thank you very much.